Hello everyone, this is Grass from Hong Kong and welcome back po to my channel, ang Psycho Hub. So today, I will give you exactly, our topic for today is very scary, okay? I just want to vlog it because I want to know also, and I searched this one from those experts, very well held, okay? So today I'm going to tell you exactly from the expert that 12 signs that someone is near the end of their life. Okay, it's terrible to learn, guys, that a loved one is reaching the end of their life. Okay, but knowing what to expect can make you more prepared for what will happen. Okay, if you've hired hospice professionals or healthcare providers can make your loved ones last months, last weeks, last days, and comfortable as possible. They can also support you as you go through this difficult time. Okay, this video will discuss, or I will discuss, the 12 signs a person is nearing the end of their life. Okay, it also suggests ways you can help your loved ones cope the final stage. Please don't forget to give me a like if you like this topic, and don't forget to press the bell button so you will be updated on my next video, psychology, social psychology tips, ways, tricks, and everything. Okay, when I come back, bye. Number one signs that you are near to death is pain. You feel pain, okay? Pain, guys, is probably the most feared symptoms at the end of life. Dying of cancer is often painful. I'm so sorry, but I just want to vlog this one. Dying of cancer is often painful, but this isn't true for every terminal illness, okay? Fortunately, guys, there are many medicines that can effectively manage pain, whatever sickness is, okay? The ability to recognize and help manage pain for your loved one is extremely, guys, important. Number two is a shortness of breath. Okay, shortness of breath or breathing difficulties are among the most common symptoms, guys, at the end of life. Some amount of breathlessness is common in most people as they are near to death. Okay, luckily there are a few simple and effective, guys, treatment that can bring quick relief, such as deep breathing exercise or relaxation techniques or oxygens and medications. Okay, number three is anxiety. Okay, anxiety is perfectly normal at the end of life, guys. A person may experience pain or shortness of breath during the dying process. Okay, this is something that can be upsetting and scary. Okay, number four is decreased appetite and thirst. Okay, as a person's body naturally shuts down and prepares for death, it is no longer needs the calories and nutrition that food provides. Okay, even though it's normal for people to refuse food and drink at the end of life, this can be upsetting for their families. Okay, since providing food is such a huge part of caregiving or caring, it often feels strange for a loved one to care for the patient and not feed them. Okay, the important thing to understand is that when someone is dying from terminal illness, the desire, guys, for less food is something natural and does not really speed up the process of death. Most patients experience a dramatic decline in the desires for food. Okay, number 5 is nausea or vomiting. Okay, sickness or medications and other treatments can lead to nausea with or without vomiting. Okay, this can be distressing for both you and your loved one. Okay, nausea medications, fresh air, eating small meals, and limiting odors are among the treatment you can try to help your loved one manage these symptoms. Okay, number 6 is constipations. If you've guys been constipated, you know how comfortable it can be. Medications used to treat pain and shortness of breath can cause constipation. Okay, other causes guys of constipation are not enough physical activity, decreased fiber and fluids intake, and the progressions of the disease. Constipation guys is a symptoms you have to stay on the top to prevent it from becoming severe. Okay, ask your loved ones, doctor or nurse how to manage it. Okay, wait, I just want to inform you guys that I know this right because I love searching every medical expert, psychology expert, all expert. I love searching their vlogs. I love reading books. I love reading what the things I want to know. Those I am so confused in everything. I always want to read. So that's why I make this channel for you guys to learn also what you want to know in every aspects in life. Just like me, I want to know what are the signs near death. I read this from the book of the experts, so now it's because I want to vlog it and so you will learn also about it. Don't worry guys, because these are all from the expert. Okay, number 7 is fatigue. Okay, a dying patient may sleep a lot because they don't have guys enough energy. It may also be because the body is shutting down. Medications can cause drowsiness too. Okay, trouble sleeping is also common. Okay, number 8 is drifting away from loved ones. Sometimes near death, they naturally start to focus inwards and separate from the worlds around them. Okay, this includes friends and family. Okay, on the other hand, others may crave closeness with those they love. Okay, either way, try to respect and take care of their needs. Okay, number 9 is delirium and restlessness. Okay, confusions, agitations, and inability to sleep can happen with some people at the end of life. Okay, delirium or suddenly acting confused and disoriented can be caused guys by the progression of the disease or less oxygen or reaching the brain or medications. Okay, sometimes guys, constipation or trouble having bowel movements or dehydration or means that not enough water in the body may even trigger delirium. Okay, the person may nervously pick at their sheets and clothing. Okay, they may even hallucinate and see people and things that aren't there. Okay, let your healthcare provider know if your loved one is showing any of these behaviors. Okay, number 10 is incontinence. Okay, both guys, urinary and bowel incontinence are common near the end of life. When you have incontinence, you can't control your urine or bowel movements. Okay, this can be a result of surgery or illness, or because the person is simply too weak to use the bathroom. At the very end, when the muscles relax entirely, the patients will often release the contents of their bowels. Okay? Number 11 is cold hands and feet and skin mottling. Okay? Hands and feet may become colder and the skin may look blotchy and purplish. Okay, it is called mottled. Okay, it happens because the heart is no longer able, guys, to pump blood as well. As a result, blood pressure goes down and skin grows colder. Okay, this mottling may slowly work its way up the arms and legs. Okay, the lips and the nail beds can turn blue or purple too. Okay, number 12 is the death rattle. Uncomfortable as it is to call the symptoms the death rattle, it's correct the description. Okay, and states wet respirations. Okay, and it is the medical term for saliva and mucus that build up in the airway when the individual becomes too weak to clear those secretions out. Okay, the collections, guys, of mucus and fluids causes a rattling sounds when the person is breathes. Okay, when the person's breaths. Okay, this can upset family and friends who hear it, but guys, most of the time the patient isn't feeling any pain or suffering. Okay, the summary of this video, the near death signs, is when someone is nearing the end of life, guys. They experience a variety of symptoms, pain, shortness of breath, and anxiety, and incontinence, and constipations, delirium, and restlessness are, guys, just a few signs that a loved one is going through the dying process. Okay, a word from very well, guys, no one wants, or a word from me, a very well word from me. No one, guys, wants their loved one to die from terminal illness. It's a frightening experience for everyone involved. Okay, talking with your loved ones, guys, loved ones doctor, and knowing what to expect can help you make them, guys, as comfortable as possible during the final stage of life. So this is the last part of my video, and if you like this content, give me like, and don't forget to subscribe my channel and the bell button so you will be updated in all my videos like this. Okay, see you again, guys, on my next video. Bye.